Hello everyone. Today we will talk about parathormone. What is parathormone? Parathormone, it is a polypeptide having around 84 amino acid residues and it is secreted by parathyroid gland. Para means around, thyroid means gland. So it must be around the thyroid gland only. So location is behind thyroid, embedded in the superior and inferior poles. You can see the parathyroid gland representation over here. Okay. Size is 6 by 3 by 2 millimeter and it has 4 lobes. Weight of each lobe is 50 mg. Okay. Mainly these are secreted by the chief cells of parathyroid gland in response to low blood calcium levels. This is the stimulus for the secretion of parathormone. Now about synthesis. It is synthesized from 1,1,5 amino acid substance pre-pro-parathormone. In the endoplasmic reticulum, there is formation of pro-parathormone comprising of 90 amino acid. In Golgi apparatus, there is formation of parathormone consisting of 84 amino acid. Now this parathormone is packed in the secretory granules and it is secreted by the chief cells of parathyroid gland. Now what are the physiological actions? So as we know that source or stimulus for the secretion of parathormone is low calcium levels, what it must do? It must increase the level of plasma calcium. So it directly acts over the bones and increases the bone resorption, thereby increasing the plasma calcium levels. Secondly, it increases the reabsorption of calcium in the distal tubules of kidney. Okay, so it will increase the level of calcium inside the body. It will stimulate alpha hydroxylase enzyme. We had discussed this thing in the previous lecture when I was showing you about the flow chart about the formation of activated vitamin D3. Enzyme alpha hydroxylase, it increases the formation of activated vitamin D3, which further increases intestinal absorption of calcium. It has phosphate uric action. It increases the excretion of phosphates. So thereby, mainly two actions are there: increasing plasma calcium and decreasing phosphate levels. Now about the regulation of secretion of parathormone. Main factor for regulation is your calcium. Whenever there is low calcium intake, there will be increased synthesis of 1,2,5 dihydroxycholecalciferol or activated vitamin D3, and it will cause adaptive rise in the fractional absorption of calcium. Reverse will happen if the intake is more intake of calcium, decrease in the absorption of calcium. So there is feedback regulation. Okay. Now the applied aspect which is associated, it is hypoparathyroidism during thyroidectomy. It may lead to hypocalcemic tetany, but plasma calcium level, it rarely falls below 7 milligram per deciliter. Okay. Next is the role of 1,2,5 dihydroxycholecalciferol. It decreases pre-pro-parathormone mRNA and directly inhibits the parathyroid action. Okay. Phosphate, as it decreases the level of phosphate, so increase in the phosphate level, it will increase the parathormone secretion. Magnesium, it will also stimulate the secretion of parathormone.